everyone, it's Dr. Shalini Gupta at the Dermatology Laser and Vein Center, and today I'm going to talk to you about one of my favorite skin rejuvenation lasers called Fraxel. And it is a wonderful procedure for anyone who wants to improve their skin tone, their texture, help with sun damage, fine lines and wrinkles, acne scars, scars of other types. It's excellent also for stretch marks and scars anywhere on the body. And we can rejuvenate any part of the body actually with the fractional technology. That's opposed to the ablative laser. So before 2004, if we wanted to do any kind of serious skin resurfacing, we pretty much had the ablative lasers. And what ablative means is vaporizing tissue or layers of the skin. So when we do a traditional skin resurfacing, what we're actually doing, I'll show you a little picture here, is taking off a continuous layer of skin. And this creates a fairly large wound, which could be really in your entire face, for example. And the results are very dramatic from the ablative lasers, but it also comes with downtime. And usually you'll have maybe 3 to 4 days or even up to 9 days of recovery time where it looks like you have a controlled burn on your skin and you have to wear Vaseline and things like that to allow for it to heal. But with the advent of the fractional technologies, we're able to create these little microthermal zones of injury. So this is not ablative. We're actually creating cones of deep heating, which will then heal and allow for new collagen fibers to form under the skin. And it will also remove some of the sun damage from the surface of the skin. Now we also have what are known as ablative fractional lasers, but that is for another topic. Today we're going to focus on the Fraxel laser, which is a non-ablative fractional technology. And what the advantage of this is that you really actually after the procedure can wear makeup. So there is no crusting of the skin, no significant recovery time outside of some redness, a little bit of swelling. So when you come in for the Fraxel laser procedure, we pretty much put numbing cream on your skin. We let that sit for maybe 30 minutes to an hour. We wipe the cream off and then we start using the laser. And when the laser is fired, we use this handpiece here. The laser energy comes out from this lens, goes through the tip, and then the tip has these little rollers on it. And the rollers pretty much glide along the skin. And during the procedure, what you will feel is sort of like this prickly sensation, like little fire ants are walking across your skin. Or think of a spider with a bunch of little hot legs that are just kind of touching you in little dots. So literally it's creating millions of little microthermal zones throughout the skin. And then after the procedure, you can pretty much cool the skin down with some ice, or we'll give you some cold air, and within a half an hour most of the heat dissipates and then there's really no discomfort at all. And a lot of patients even gone to social events that evening, but you can actually wear some makeup to cover the redness too. So it's nice because there's not much recovery time. Usually a day or two later, when you touch your skin, it'll start feeling really gritty. And that's because, let me show you this. So after we've created the little microthermal zones of injury, these little plugs of skin that are on the surface, they just pop right off. And that's the grittiness that you're feeling. So a lot of patients will call us back and say, oh, it feels like sandpaper, and we'll tell them that's perfectly normal. That is to be expected, and that's a great result because that means that it's working and we're getting the skin to exfoliate, and then it is going to create new collagen fibers as the skin heals underneath. And let me just show you a little video of the laser actually firing across the skin. And then I'm going to show you some pictures of what you might see as results from the Fraxel laser. So here is a skin rejuvenation rejuvenation procedure, somebody who has sun damage and some signs of aging. And you can see an improvement in texture, quality of the skin. There's always such a nice glow after the Fraxel Laser procedure. And we do recommend doing a series of treatments with this, usually every 2 to 4 weeks apart. Most patients come every 2 weeks. You can do the treatments as close as a week apart. And the reason for doing a series of treatments is that if you remember, each time we do a treatment, we're covering about 20% of the skin surface. So with usually 4 treatments, we're getting close to 80% of the skin surface being affected. After you do a series of 4 to 5 treatments, we recommend that you come in periodically for maintenance treatment, which could vary from person to person, also depending on your lifestyle, your other aging factors, but usually, sometimes once a quarter, sometimes twice a year, sometimes just once a year, and sometimes we don't see patients for a few years and then they come back and repeat a series of treatments to get their skin back on track. We can also combine the Fraxel Laser with other procedures, and it's really beautiful when we do it in conjunction with Botox or fillers, or even like a BBL type of laser treatment to help more with the pigmentation and brown spots. Although Fraxel Laser will do a pretty good job on pigmentation, and also it does a pretty nice job on rosacea, or getting some of the red out of the skin. So this is an example. Here's another example of skin rejuvenation. Again, you can see the disappearance or the improvement of the wrinkles on the face, around the crow's feet, and an overall smoother texture, less mottling, and better glow. This is a much older patient, but what's nice here is you can see even a little bit of skin tightening and firming as the Fraxel Laser has rejuvenated the collagen and elastin fibers under the skin. Here's another example of a patient with sun damage and pigmentation. We can use this procedure on patients of all skin colors and types, although with Asian skin types and darker skin tones, I will recommend using a skin lightening product starting before the procedure and ongoing while the procedure is happening, and good sun avoidance afterwards. Here's another close-up showing an improvement in the crow's feet and the wrinkles around the eyes. Same here. Now in this picture, you'll also notice that there's a scar around the eye that has nicely vanished and is not so visible anymore. Acne scars, great treatment for acne scars. Here's an example before and after. Another example here. A little bit milder acne scars, but again, you can sort of see the discoloration and redness. And I really love the Fraxel Laser for this post-inflammatory redness as well. Off the face, we can treat the neck, the chest areas. You can see a dramatic improvement in the wrinkling, firmer neck. Hands are important to treat. Sometimes the hands give away our age, so a lot of patients do recognize that and then want their hands treated at the same time. Some more sun damage before and after. Here's a surgical scar that did pretty well after a few treatments. Some more sun damage and pigmentation. Really beautiful improvement in skin texture. You can really see that glow just emanating from the skin. We can also improve melasma, acne scars. Here's a beautiful picture of the chest. Some more scars on the neck area. Deeper acne scars. And here's another surgical type of scar that improved very nicely. And stretch marks do really great with the Fraxel Laser. We see a very dramatic improvement in that as well. So that's pretty much it about the Fraxel Laser. We look forward to your questions. We look forward to being able to help you with this technology. We're fortunate to have it. We have a lot of experience with it, and it's one of our more busy procedures. You have a wonderful day, and see you soon.